Welcome back to Blueprint to Heal. I'm really excited to interview Candice Bradstreet today. I have been following her for a long time. I followed her brother-in-law, Bradstreet, and honestly, Candice, I love the information you post. You are one of the few groups that I make a point of checking in daily because, like you're probably in a lot of groups too. I want to make sure the information I'm getting is really top notch. And that was why I wanted to interview you because I just felt like you bring the goods. You're not
Oh,
all
thank
talk.
you.
So
That means a lot. Thank you.
yeah, so one of the things that you work with is something called GcMAF,
Ye-
GcMAF.
Yeah,
And I believe your brother-in-law was very involved with that in helping people in this country. And, why don't you tell us what that is and why you're so interested in talking about it?
sure. So GcMAF stands for glycoprotein macrophage activating factor. And the reason that's important is because GcMAF is critical to how our immune system functions. Um, Before I get into how Jeff started using it, the way that we determine if somebody needs GcMAF is through nagalase testing. And the reason I bring up nagalase is because that is an enzyme. We already create nagalase, but in the presence of cancer or high viral overloads, which that would include autoimmune disorders, what happens is the nagalase gets out of control. It gets out of range. And so what that means is that nagalase basically hijacks the macrophages, which we obviously need our macrophages. That's a huge part of our immune system that gets rid of pathogens, bacteria, cancer cells, and so forth. So I don't want people to think that your immune system isn't working at all, but what I always tell people is if you have high nagalase, that means healing is going to take longer and it's going to cost you more because you're fighting an uphill battle. Um, Jeff actually was the first doctor to use GcMAF. He basically repurposed it for autism. A lot of people get confused and think that he found it, he created it, and he didn't. That was Dr. Yamamoto in Japan. Jeff actually started using it for children with autism. And one of the main reasons he started using it is its ability to reduce the inflammation that these children have, not to mention in his practice, we noticed with every child they did have a high viral overload. That doesn't mean everyone does, but the majority of them have a high viral overload due to the vaccines and vaccine injury.
So, so one thing, what can destroy or affect the level of Nagalese that we're producing naturally?
Well, that's the thing right now is that GcMAF is really the only anecdote per se that we have, because you can't get GcMAF in food. Although, and I wanted to cover this briefly, a lot of people think that you can make your own GcMAF out of dairy because there was another product he was using called Bravo, and it's a fabulous probiotic, but it started being sold as though it's equivalent to GcMAF, and it's not because scientifically, and I'm not a scientist, but what I have learned and what I know through the lab that I work with, you can't make proper GcMAF out of dairy because it's too acidic. And so a lot of people, thought that they could do that or use Bravo for that, and it does not have the same impact that GcMAF will.
So I don't think you understood my question. I was like
Oh,
wondering what causes Nagalese to
Oh,
be
the
impaired. The
oh,
right because
Nagalase impaired or increased.
no, what causes it? So like I think you were saying that there's a test to see how much
Yes.
Nagalase you're producing. So what would cause that to be affected? If the production of it,
Oh, the high Nagalase is directly due to either cancer or high viral overloads.
okay.
That is what causes the Nagalase to increase. I thought you meant like what other things can help reduce it, because a lot of people do ask that.
Yeah, I was just wondering what would cause. So if
Yeah.
somebody had, so I guess the reason why I'm asking is like, how would who would be interested in looking into this? Like, what kind of health problems? Obviously, you mentioned cancer.
Yep.
Somebody who's on the autism spectrum, no matter what age. So, what other kind of health problems would someone who might be listening to this say, "Oh, maybe I should check this out too"?
So anyone that has autoimmune, so that would include Lyme, Epstein-Barr. I have the herpes chickenpox varicella virus, and actually it was the GcMAF cream that actually cured my Hashimoto's. And that was directly caused from the virus, because there's so many studies now showing that your thyroid just doesn't decide not to work. It's generally a virus is attacking your body. Even rheumatoid arthritis sufferers, it's good for. There is also scientific evidence that dementia and even Alzheimer's, and as this product continues to be here, the lab is always, we're always doing studies on other health conditions. But we've used it for so many different autoimmune disorders. So it's not just for autism, it's not just for cancer. It would be any type of viral condition that you have that then causes the things such as Epstein-Barr, Lyme, and those things.
Oh, this is huge because trying to heal from any one of these issues, as you and I were chatting about before I hit the record button, I definitely have autoimmune stuff that
Yeah,
for me, it was triggered from stress from not sleeping for two and a
yeah,
half years due to a really bad injury that I had had. And it just really knocked me out of balance. And yes, there have been times where I've done better. At one point I was diagnosed with Hashimoto's, which I did correct on my own. I caught it early, but now I have just inflammation, that I do have a positive rheumatoid arthritis, lab work done. So I'm definitely interested in getting this evaluation done
yeah,
because it's tough. Anyone who's living with autoimmune cancer, any of these issues, it's tough because you never know what your day's going to be like. You know,
correct.
like I was doing great for several weeks. I was feeling fantastic. And then I was actually playing around with the vibration plate because I also have an issue with my lymphatics. Because I'm living in so much pain, I'm not getting the exercise I should. And then I feel like the
Yeah.
lymphatic system gets all stuck. So I started playing around with the vibration plate, sitting on it, and I overdid it.
Oh, goodness.
And massive pain throughout my body. And I do something called exogenous ketones, which just helps to bring it down, but it doesn't fix the problem.
Right.
I'm 66 now, and I'd like to think I have another 20 or 30 years left, but I don't want to live it like this.
No, and I agree that autoimmune, um, it's really difficult because I always tell people it's actually like peeling an onion back, because you resolve one thing and then sometimes another thing comes up. And that is something that I did want to say is that we don't look at GCMF nor promote it as an absolute cure. I will tell you though, scientifically, and just the things that I've seen with my clients, it has helped them tremendously to be able to either heal or to actually just eradicate the issue that they have. That was another thing that Jeff was using it for that he was very quiet about. People knew that he was using it for autism, but it was interesting because when we went to his funeral, this gentleman came up to us and he wanted to donate to the GoFundMe we had for the investigation. And he just said to my husband, he said, "Your brother saved my life," because this gentleman had stage 4 cancer and he was seeing Jeff for treatment and he was cancer free. Now, does that happen all the time? No, because everyone is different. The cancers are different. And it really matters how soon you actually use GcMAF. Um, Stage 4 cancer, where they've basically been told there's no hope, I'm always honest that GcMAF is like a Hail Mary. Because at that point, if it's gotten that bad and to that extent, sometimes you don't have time to turn it around quickly. But when I say that, I actually have seen stage 4, zero hope, and they've recovered.
Oh, so is it generally so for, well, one thing I want to ask, I think you said it's a cream that you put on.
Well, we have the cream, and that's the newest addition. But prior to that, there's a spray, which that was specifically designed primarily for children with autism because it's sublingual or nasal, and it was just easier. Jeff was using the injections, which those are still available as well. So there's actually 3 modalities now of GcMAF.
But unless you're a doctor or nurse, you're not going to be doing injections unless is it something you can teach somebody how to do?
The injections are very simple because it's in a small roll of fat in the stomach and it's sub-Q, so it's with a diabetic needle. So it's very simple. And in fact, when it was allowed for doctors to be giving this to their patients in the office, that's how Jeff would do it. And then he would train, though, the parents to be able to do this for their children because it's kind of like, I guess, if you think about like diabetics, having to give themselves insulin, it's kind of the same thing.
And how would you determine which modality is the best way for somebody?
Generally, for cancer, it's always the vials. It's always the injectable because it's going to be more potent and stronger. In my case, it was the cream. For my husband, when he had cancer, and then even after, because I still will take nagalase test on him 1 to 2 times a year, because it is kind of a soft way to find out if there's any issues going on again. Um, and so it depends on each situation, honestly. I can tell you for skin cancer, I have seen the cream do amazing things. Um, where people, it's literally gone, and they've gone back to their doctor and they've gotten confirmation that it's gone.
Wow.
And the cream is actually very versatile because I've used it on wounds, I've used it on cuts, I've used it on bee stings, I've used it on rashes, and it has this amazing ability to calm things down. And like I said, with the skin cancer, I've had 3 clients that it got rid of their skin cancer.
So, what other kind of health issues have you seen improve or resolve using it?
Um, Let me think, because there's just been so many different things. Definitely, especially with autism, what I have been seeing, and I actually just posted about a client that I'm working with now, Sophia, and the dad keeps messaging me daily of what he is seeing. So, for example, she's 12 years old, nonverbal, and has been in diapers. She is now she's now showing through her eyes that she's understanding relationships, if that makes sense. We know
Yeah.
children with autism don't understand that two-way type of thing. And she's now grabbing his hand and taking him to his car keys to let him know she wants to go for a ride. But the biggest thing that just happened yesterday is normally she obviously is in diapers, so she'll wake up with a wet diaper. The last 2 days, she's woken up with a dry diaper, and yesterday she actually started going to the bathroom on the toilet for the first time since she was 3. And so I love sharing these stories and improvements. But yet I have to be honest that every child is so different. And that is what is so difficult about autism because parents get so hopeful, and they should, because GcMAF still does really, it improves the way that the children with autism actually associate with their parents. It's almost like you can see them breaking out and breaking free from, I call it being trapped, because
Yeah.
that's how I feel is they're in there. We know they're there. They're incredibly intelligent, but they're trapped. The other thing I have had reported back with GcMAF is less joint pain, sleeping better. These are like the minor ones that sometimes are unexpected. So it's really specific on what the person has and what they're dealing with.
Yeah, and I got the chills as you were telling me that because I know parents with, you know, children with profound autism, especially you're seeing a lot of these kids now in their 20s.
Yeah.
And it's so sad because it's like, it sounds to me like everyone should at least get tested for this.
Yes. In fact, before Jeff died, it was a couple months before he died, he would always call my husband to update him on, all the neat and great things that were going on. And he was having incredible results reversing autism with his patients at that time. And he had told my husband all about GcMAF. And he's like, he really actually believed everyone needed to get tested and to use it. And what I love about GcMAF, so people understand, it's not a long-term product. So you take a baseline nagalase if it's high, and we know depending on the levels what the protocol will be because the dosages are different. And then after 3 months, because it is a minimum of 3 months, because scientifically it's been proven, it takes approximately that amount of time to reduce the nagalase levels. But again, everyone's different. And then after those 3 months, we take another nagalase. And if people are within range, you no longer have to take it. So I like that because I've always said if you have to be on a product long term, it's not getting to the root issue and it's not healing it outside of obviously supplementation. Supplementation is something we do daily. But a product like GcMAF, it's not meant to be long term.
And if it's going to help reduce inflammation, the inflammation could be in the gut. Like here's
Yes.
my thing. Like I used to do a lot with supplements. And then at some point, I don't like taking a bunch of supplements,
Yeah, neither do I.
and I could take a handful, I could swallow them, but to me, it always felt like I'm taking all these supplements. How do I know if they're even working? How do I
Correct.
know if my body can digest it? And I
Correct.
think you know this as well as I, that if there's gut inflammation, our body's not going to be able to break it down. It's not going to be able to absorb the nutrients. And
Yep.
that's why I've moved almost totally to liquid, things
Yes.
that are sublingual, because that'll
Yep.
go right into the bloodstream. So I think that it's really important to understand how important this is if you do need supplements for therapeutic reasons, maybe
Yeah.
you should look at this first to decrease the inflammation so your body can actually use those supplements. Because I think, and this is just my opinion, I think that if you're loading up on supplements and you've got leaky gut and your body can't process it, that you might actually be doing more damage.
You are absolutely correct. And that's actually what we really realized at the International Autism Center. Jeff realized that with leaky gut, these kids were not absorbing nor using any of the supplementation. And I'm glad you brought this up because there's kind of a misnomer in the community, in the autism community. I've had some people say that there are some, other mothers out there saying, well, you need to do this, this, and this, and this first before you even do GcMAF. And that's actually the opposite. If you have high nagalase and so much inflammation, it goes back to what I said earlier. It's going to take you that much longer and it's going to be that much harder to get proper healing. And GcMAF, by the way, there are zero side effects. We've had zero side effects reported. Any medical articles that you pull up or papers also discuss this, and there are a lot. There are a lot of medical papers and studies that show its effect on cancer and the other things that we discussed. We've even had people that have used it in conjunction with chemo and they actually fared very, very well.
Wow.
Yeah, so
My next question was going to be if there were any side effects. So you beat me to the
yeah,
punch on that one.
There's none. And if you want to consider like so with children with autism or people with a very high viral overload, it is important to go slower because otherwise you're like over reactivating the immune system too quickly, possibly, where then the worst thing that's going to happen is maybe like a Herxheimer reaction. But generally, those are avoided based upon the protocols. But there is zero damaging side effects. There's none at all. And that's why I like it so much. And it also works great in conjunction with stem cell therapy, which a lot of parents with children with autism do and they seek out.
Well, if you think about it, if your body's inflamed anywhere, your body's going to be putting a lot of energy and resources into
Yeah.
reducing the inflammation.
Yeah,
So if you can reduce the inflammation first, then anything else you do after that will be more effective.
absolutely.
So,
Absolutely.
so you said there's no side effects. What about contraindications?
There are no contraindications with GcMAF, but we do our due diligence, meaning, let's say if I have a patient and they're on certain medications, we always cross-reference, and as of right now, there's not any that are contraindicated with it. Um, so again, that's why I love the product because it's simple to use and very, very effective. And again, for me, I like that it's not this long-term product that you're going to have to be on for life.
Yeah, I love that too. And so I know that there's been a lot of research that has found that the brain of somebody with autism is very similar to Alzheimer's.
Yes.
So, what kind of, I know that you've said that there's a good, there's a lot of people getting help with dementia. So, what about something like Parkinson's or MS, other kind of
Oh,
neurodegenerative?
thank you. MS, yes. That is another one that I forgot to mention, but yes, we have many who do very well with GcMAF for MS. Parkinson's, to my knowledge right now, I don't believe we have a study on that yet. Would it shock me if it helped? Which I do know we've had people that have used it. And it has driven the nagalase levels down, so which is a great thing. So that means it does impact for the inflammation. But as you and I know, Parkinson's is a multi-layered thing of, needing to do heavy metal detox and those things as well.
Yeah, I'm thinking of for people, they've already done the heavy metal detox and they're,
Oh, yes.
yeah. So
Yep.
so would you recommend doing a heavy metal detox first?
Yes, if, and I say if possible, because to be honest, I've had consultations with parents who haven't done the heavy metal detoxing and we still get amazing results. Would I personally suggest that you do those together at the same time? No. Because you and I both know heavy metal detoxing is
It's a lot.
it's a lot. It's a lot on the body. Um, and it also depends on the type of heavy metal chelation that somebody is doing. So we definitely would not do those two together.
Okay. So, what about my dog is starting to bark, little booger.
Is he?
He's growling at something. I'm not sure
I
what.
can't hear
Uh, um,
him.
so, so you also mentioned that Jeff used it specifically for, for cancers and people on the autism spectrum. Was he noticing any other kind of people that maybe just popped up here and there that he was able to help?
I know for him, I know for himself, he definitely used it because he always had really terrible knees. So he used it obviously to reduce the inflammation there. But primarily, it was for the scope that we discussed, the autism, the cancer, the autoimmune, and things of that nature. But for him, the majority of his was autism. It was the majority of his patients for sure.
And is it legal?
Well, so we have the lab because the lab's in Europe. So there is European approval and we don't have FDA approval, but it's not illegal.
Yeah.
So if that makes sense. Because with the European um, approval, that has changed a lot of things. So when Jeff was using it, this was back in 2015, all of a sudden in January of 2015, the FDA came down and said doctors are not allowed to use it. You're not allowed to ship it across state lines. So he immediately stopped using it. And then he did his autism presentation in May, in which he said, and he had never said this before, he said, we are close to a cure because of the what he was seeing. He was seeing a large amount of his patients that used GcMAF, they were basically losing the diagnosis of autism.
Wow.
And then less than 30, oh goodness, so sorry. A phone call came in. Less than 30 days later, he was murdered after
Right.
that presentation. So, um, you know, the whole FDA thing, will it be legal here? I don't know. I honestly don't know. I know there was a large lab, I think it was called Efranet in Israel, that was studying GcMAF for FDA approval
But and
or
it's so
whatever their approval.
frustrating. Yeah, it's so frustrating because in Europe and probably even in Canada, so many things are legal there that
Yeah,
are not legal here. And, in my opinion, is we should have the right as individuals to try whatever we want. I, you
I
know,
agree. I agree.
and I know the whole thing with FDA approval is you can't say something is a treatment for something,
Correct.
right? Unless it's been FDA approved. And then you can only say it's a treatment for something for whatever fine areas that they want to approve it for. And, the other frustrating thing is, we know that a lot of people on those committees that give FDA approval are people that work directly for the pharmaceutical companies. And,
Exactly.
they're not going to want to approve something like this because it could take away their profits.
Exactly.
So
Exactly.
it's very frustrating, that system really needs to be overhauled. As I said, I think at the very least, people should have the right to do whatever, try whatever that they want and let the let that be their responsibility.
I guess the whole my body, my choice doesn't really apply there now, does it? Because that's how it feels. It's like, and we all know supplements aren't FDA approved either.
Right.
But I of course agree with you 100%. If it's something that I want to try and I want to do, it should be okay. It shouldn't be based upon because the government told me it was okay.
And like even chiropractic, for instance. So I'm a chiropractor. I'm allowed to say that I treat back pain, and that's it. But I could tell you in 30 years of practice, I've seen so many cases of, I've seen autism improve.
Absolutely.
I have seen, ADD, ADHD improve. I've had women that were previously infertile get pregnant,
Yeah.
asthma clear up. I've seen all these health conditions clear up, but I'm never allowed to say that because,
Exactly. Well, and if you go on my website, you will see because I do, I of course want to adhere to, the rules, the laws of the FDA. Otherwise, it makes it difficult, but that's why there's always the statements of this is not FDA approved. But again, if someone wants to utilize it for their own health, it should be okay.
yeah. And that goes for any drug too.
Absolutely.
It's not just this. I think that we're adults and we should be able to make those decisions and we shouldn't have a government telling us what to do. And that ties into this whole one size fits all problem, right?
Yes,
Like right now
absolutely.
with measles, there's a measles outbreak and people are freaking out. I mean, not you and I, but and probably no one that's going to listen to this, but the truth is, even measles is, every person's going to react a little differently because we're all
Yep.
individual. And, the risk of getting an intervention like a shot is probably going to be a lot more of a problem than just
Right.
allowing your body to get this self-limiting illness. So I think that we need to have these conversations on a broader level. And there needs to
I agree.
be people involved in the conversations that don't have a vested interest in the pharmaceutical industry. And that's tough because they're so powerful.
They really are. And, as we all know, and what frustrates me more than anything, and I'm sure it frustrates everyone, is how there's all these medications on the market, and yet deaths, injuries, all these things happen. And then we're just supposed to be okay with when years down the road they go, oops, we realized this causes this and this and this. When GcMAF, there has never been anything bad that's happened from it. They tried, and I'm bringing this up because when people Google GcMAF, it comes up, particularly with Jeff. They try to say that there were 4 patients in Switzerland, which, by the way, Jeff never was there, never was a doctor there, but they wanted to connect him to it just to basically smear him. And it was literally their last hope. So again, they were at the last stages, they were dying. They did GcMAF and they died
Right.
because stage 4. Well, guess what they did with that information?
Of
That's
course.
where they keep saying it's dangerous. There's nothing else that has happened negatively. And that wasn't even, if you will, negative because they knew it was their last hope and they chose to do it.
Yeah. So, how much does it cost to get the testing? How much is the cost for the GCMAF?
So the testing, we now have at-home Nagalase test kits, which are 99% accurate. So people will get results within 15 minutes. It's a poke and stick. Those are 185. And within 15 minutes, it's not quantitative, but it will show, it's almost like a pregnancy test, actually. And they've just been working really well because one, it's more instant. It's more, I'm not instant. Well, yeah, it is instant within the 15. But prior to that, people had to go and get a lab draw and send it into, there was only one lab here that was testing for Nagalase for years. But I received a letter that they're actually restructuring right now. So
Mm.
I'm not sure what's going on there. So I'm really glad that we have these at-home Nagalase test kits. The GcMAF, the pricing honestly all varies upon the protocol and what people are going to use it for. And I know that's not a cut and dry answer, but it truly is based upon their Nagalase test levels and what you're treating for.
Okay. All right. Well, this has been really informative, and I really appreciate you coming and sharing your wisdom. Is there anything else you'd like to share before we end the conversation?
I don't think so. You're just amazing. And you covered and, we discussed really all of the highlights and the important parts of GcMAF. And I want to thank you for even having me on here and doing this because a lot of people did assume that when Jeff died, that GcMAF kind of was gone because there was a time frame where we couldn't access it. Um, but myself, along with actually one of his colleagues that I work with, and several other doctors, are still really trying to keep it alive and to help people and to make it accessible.
Great. And what I'm going to do is I'm going to include links for how people can reach you.
Sure.
Maybe if you have links to studies, we can put those in the show notes as well.
Yes, actually, I'm very excited about this. Mary, my colleague I was talking about, she's in our private groups and you'll see a lot of her posts, but she actually finalized and it's up and running. It's our GcMAF website. So that has
Great.
all of the clinical trials, all of the medical papers. So I will give you that link as well.
Awesome. I can't wait to get that. And And again, I look forward to talking to you again because I know we're going to have more conversations on other topics that
Absolutely.
we're both pretty passionate about. So thank you again.
Thank you.